All right, everyone. I have a very special guest with us here today because, as you know, we've gotten a little update on Mike Smith's situation, and unfortunately, he will not be able to have limb salvage surgery. They're going to have to do a full amputation. With that being said, he's going to most likely need some sort of prosthetic in his future here. And lucky for you, I know an amazing prosthetist and orthotist who also happens to be my cousin, and she is here to talk to you all about her career as well as the different developments that have been happening in her field. So I'm so excited. So welcome, Nicole.
Thanks. Hi, everybody. Like your teacher said, Miss Pelletier, I am Nicole Walker. I have my master's degree in orthotics and prosthetics, and I'm also a certified prosthetist orthotist. So I'll kind of get into a little bit talking about exactly what is prosthetics and orthotics. It's its own field, how I got to where I'm at now, and then we'll talk a little bit about some innovations in upper limb prosthetics. I saw the scenario that you guys are working with, and then kind of just some other prosthetics and orthotics related things. And then at the end, if you have any questions, you can let your teacher know and I will hopefully be able to answer that. We'll start kind of just by defining what exactly is prosthetics and orthotics. So starting with prosthetics, the field of prosthetics is the study of anything related to artificial limbs or supplemental devices for someone who has experienced limb loss. So what the actual device is called a prosthesis. And the prosthesis is the device that replaces a person's limb. There's some examples here that I've included on the slide. The person on the top left has a transhumeral prosthesis. They have an amputation through their humerus. On the bottom, cool robotic hand that we'll look at a little bit more detail as we move on. And then you might be familiar on the right side there, a Paralympic athlete who was on Dancing with the Stars. And so she did all of her dances, obviously, using her prosthetic legs. That's the field of prosthetics. And another element of the field is orthotics. Orthotics is something, an externally applied device that supplements the function of the body. After someone has any sort of disease or disorder that affects the function of their musculoskeletal system, you might use an orthotic device to supplement that function or to relieve pain or to create adjustments within the body. So maybe you or somebody you know has ever worn a scoliosis brace. On the bottom left here, which over time, when it's worn, it can help to guide the growth of the spine and reduce some of the curvature of the spine for people who have scoliosis. Up top is something called an IDEO brace, and this was developed for people who are in the military who had some type of traumatic injury to their lower extremity. And this device was developed to relieve some of that pain and allow them to get back to a level of functioning where a number of people who are in the military were able to go back to active service after experiencing a traumatic injury. And then on the far right, maybe you've seen a child who has Down syndrome or cerebral palsy or any other variety of musculoskeletal disorders, and they wear ankle braces. Those are called AFOs, ankle foot orthosis. And so that all falls into the field of orthotics. So the orthosis is the actual device that we apply to somebody who uses or requires a orthotic bracing. And an orthotist, and the same on the previous slide, a prosthetist and an orthotist are the people that are trained and certified to actually fit and fabricate and understand the function of these devices and provide them to people who require them. We're part of the healthcare field. We work very closely with physicians, physical therapists, occupational therapists to ensure that the people who require prosthetic and orthotic devices get what they need. So there's a couple different ways that you can get to where I'm at now. So I'll just kind of touch on my personal journey. It's different from other people who are in the field. After I finished high school, I went to Stanley Lake High School in Westminster, Colorado. After I finished high school, I went to Colorado State University in Fort Collins, and I studied health and exercise science. So there are a number of different backgrounds that people who work in orthotics and prosthetics can come from. I came from an exercise science, kinesiology sort of background. I had classmates who were engineers. I had classmates who had majored in mathematics, a whole bunch of different different ways to get into orthotics and prosthetics. I even had one classmate who had a master's degree in zoology and had spent the previous 3 years chasing like swarms of bats around the country. But as long as you get the prerequisites for O&P school, it doesn't really matter what your background is. And it was really fun bringing people in from a whole bunch of different backgrounds to hear their perspective. So after undergrad, I finished my 4 years of undergrad, and then I went to Baylor College of Medicine in Houston, Texas. And this is where I did my orthotics and prosthetics training. So got my master's of science in orthotics and prosthetics from Baylor College of Medicine. And after I did that, I had to sit for my board exams. So I sat for my board exams over the course of about a year, based on scheduling and everything, in order to become a CPO, certified prosthetist orthotist. So since becoming certified, I now work in Minneapolis in the MADE program, Minneapolis Adaptive Design and Engineering program at the Minneapolis VA. And I have also gone back to school. I'm getting my PhD in rehab science at the University of Minnesota. So that's my personal journey. Everybody's journey is totally different in orthotics and prosthetics, but that's how I got to where I personally am today. Ms. Pelletier shared the scenario with me, so I read through it, Mike Smith's scenario. So it sounds like limb salvage no longer was an option based on his cancer, and so now his care team is looking into amputation. And part of what it sounds like his amputation care will involve will be receiving a prosthetic limb. And so that's great. We can kind of look into some innovations in prosthetics. What's the outlook for where upper limb prosthetics is moving, as well as lower limb prosthetics and orthotics as well. So we'll start here with speaking about body-powered prostheses. So body-powered prostheses are prosthetic devices that are powered by force input from the user. So as you can see up here in the top left, this individual has a body-powered prosthesis. He's wearing a harness that goes underneath his armpit there. There's a cable that comes down from that harness and connects to this hook here. So in order to open and close this hook, he puts force through the harness, and that translates through the cable. It's the same thing as the cable on your bike, the brake cable. And so as he puts force in with his muscles, this pulls the cable and opens the hook. So then he can come over here, grab a pen or grab a cup, and then relax, and the force around the hook holds on to whatever he's grabbing. So this is kind of the most basic variety of an upper limb prosthesis. If you all watch football, maybe specifically the Seattle Seahawks, you'll know Shaquem Griffin on the bottom right here. He was the first person to play in the NFL with an amputation. He has an amputation through his left wrist. And so at the NFL Combine, when he was being scouted to join a team, he used a body-powered prosthesis to bench press, I think it was more than 300 pounds, using a body-powered prosthesis that was designed specifically for him for weightlifting in that scenario. So those are both varieties of body-powered prostheses, anything where the user inputs their own muscle force to control the device. And then we can look at another variety of upper limb prostheses, and these are externally powered prostheses. So an externally powered prosthesis depends on input from a battery source or some kind of, energy input to power the prosthesis. So this is maybe kind of more what you might see on some news stories, or if you've ever been scrolling on Facebook, or maybe not Facebook. I hear younger people don't use Facebook so much, but Facebook and Reddit or TikTok. I've seen it on TikTok too. You might see some externally powered prostheses, and this is powered by an external source like a battery, and this input from the battery is what allows for the motion of the hand, the changing of the grip patterns. So there are some advantages and disadvantages to both body-powered or externally powered prostheses. For externally powered prostheses, there's a whole range of different grip patterns, and a lot of these hands allow the user to program whatever type of grips they might need in their everyday life. And so, the hand can store a dozen different grips for different activities. So there's some versatility there, but on the flip side, you have to remember to plug in a battery every couple days. And depending on the user, where that may or may not be feasible. Body-powered prostheses are very simple, they're easy to maintain, but sometimes they're not as aesthetically pleasing as something like an externally powered prosthesis is without the cables and the harness and things like that. So on the top right here, somebody using an experimental hand that's been developed by the military. And over here on the right, another transhumeral, a person with a transhumeral amputation like we saw before, but instead this person has an externally powered prosthesis. Okay, so kind of getting a little bit deeper into externally powered prostheses, there are a variety of different control methods. So the way that externally powered upper limb prostheses are to control the motion, electrodes are implanted actually on the inside of the device, the socket, which is the part that the residual limb goes into. And so there are electrodes within the socket that can sense electricity within the muscles underneath the skin to understand what type of motion somebody's trying to create. So on the left side, we have standard dual site control. So this includes two electrodes that are placed on opposite muscles, on antagonistic muscles. So if I've got an electrode here on the inside of my limb and I want to close my hand, I wouldn't have my hand, I'd have my residual limb inside the socket, but in theory, I would use the muscles that I usually use to flex my wrist. The electrode would sense this electricity in my muscle and it would close the prosthetic hand. On the opposite side, I might use the muscles that I use to extend my wrist, and now the prosthetic hand would open. So this has been pretty standard control since about the 70s or 80s. And it works well for some people, and for some people, it just doesn't work. It's hard to train your muscles to act in a certain way. It's maybe not as intuitive. And so in more recent time, actually originally developed at what is now Shirley Ryan, used to be the Rehab Institute of Chicago, is pattern recognition control. So the way pattern recognition control works is that there's a series of electrodes throughout the entire socket. And instead of the user having to learn how to use one muscle to close the hand and use another muscle to open the hand, pattern recognition control learns the user. So there's a training system that the device will go through, and it will say, okay, create the motion of closing your hand. And so the user will think and they'll say, okay, these are the muscles I would usually use to close my hand. And then it'll say, okay, do the motion for opening your hand. And the user will think, okay, this is the way that I usually open my hand before I had my amputation. And that series of electrodes, there's usually between 12 and 16 or more electrodes on the inside of the socket. And it learns which spots and which areas of the muscle and of the residual limb are firing when you're trying to create a certain motion, and it learns those patterns. That way, now when it gets the sense that, oh, the muscles that are used for closing the hand are firing, let's close the prosthetic hand. And so it's a totally different technology. It uses the electrodes and it uses the electricity in the muscles, but there's some argument maybe that and some research saying that it's more intuitive. It's a little more natural to control than the user having to learn how to use the prosthesis. Instead, the prosthesis is learning the user. So let's chat a little bit about some surgical innovations in prosthetics. The first one being something called osseointegration. And so osseointegration is almost exactly what it sounds like, osseo being bone. And this technology integrates an implant in the bone that is used to suspend the prosthesis. So this eliminates the need for a prosthetic socket. So a couple slides back, we talked about the prosthetic socket. That's the actual hollow device that the person puts their residual limb, their remaining limb into to use the prosthesis. So an osseo-integrated device, there's literally an implant sticking out of the end of the residual limb. You can see it here on this photo, and you can see it over here as well. There's a metal implant that is surgically implanted into the center of the bone, and the prosthesis actually clicks onto the end of this metal implant that is coming out of the person's residual limb. So this completely eliminates the need for a prosthetic socket. This is a potential solution for people who struggle with prosthetic socket fit, whether it's due to the shape of their residual limb. People who have traumatic amputations sometimes have skin that's been burned or skin that's been grafted or skin that's very, very sensitive, and fitting a prosthetic socket just isn't functional for their needs. And so osseointegration plays in, where you might have success with this metal anchor that's surgically implanted into the bone, and the prosthesis attaches directly to the end of the bone. On the left side here, you can see these black cuffs that this individual is wearing. That's where those electrodes are housed. So you still have to have a way to access the muscle activity, even if you have an osseo-integrated prosthesis. And so this user wears this black cuff, and that's where those electrodes are housed to pick up information about which muscles the user is firing at any given point in time, and then to control the motion of the hand and the elbow in this sense, in this scenario. So on the right side here, another individual, I imagine he too uses the electrode cuff, but might not have had it on just for the prettiness of the picture in this situation. But there he is using his osseo-integrated prosthesis to reach up and grab a pitcher out of the cabinet.
Nicole, I have a question for you on these. Is
Yes.
there any higher risk of infection for these patients potentially?
There is. So one issue that obviously comes up for osseo-integrated patients is that you have this spot, this interface now, where you've got the outside world interacting with the inside world, right? We know bacteria and viruses and everything are very small, and they can definitely make their way, through that new spot that you've created in the skin. So people who have osseo-integrated prostheses are required to fit a number of criteria before being eligible for osseo-integration, and one of those is hygiene. And so you have to be able to keep up with hygiene. They require being cleaned and being maintained every single day. And so this isn't a solution for everyone. It's definitely unique, and you have to be the kind of person that's willing to try something that we haven't perfected yet. That being said, I think there's 5 or 6 sites now in the United States that are doing this implant surgery for the general public. It used to only be available in Sweden and Australia, and now we're starting to do it here in the United States. The person on the left, I believe, was part of a military-funded study, but this guy is from Sweden. And so, yes, there is definitely potential for infection or for issues at that site that could require further surgery, could require the implant to be removed. And so it's not common yet. It's definitely still in its development stages, and working out how exactly we can make the technology more accessible for people who need it.
So interesting. Love it.
Kind of scary. Interesting, a little scary, but it's a really interesting technology and surgical procedure. Another surgical procedure is something called targeted muscle reinnervation. So what the surgeon does when they complete a targeted muscle reinnervation surgery is that they take as much of the remaining nervous tissue and nervous system that remains for controlling different motions, maybe below the wrist. So there's a nerve that'll control your wrist flexion, a nerve that'll control your wrist extension, and as much of that remaining nervous system that they can preserve, they will take that and they'll implant it into more proximal muscles. So they might take the nerve that controls wrist flexion and implant it in one of the heads of the bicep. And they might take another one that controls hand opening and take that and implant that in the tricep. And so the idea with that is that then when you use the electrode setup that senses the motion or the electricity in the muscles to create motion in the prosthesis, now you're using the same nerve pathways from the brain. You're using the same nerve pathways that might have controlled hand opening before your amputation. And now we can put an electrode over that spot and get the electrical activity from that spot without you having to necessarily train your brain to use your muscles in a way that you didn't use them previously. So the example on the top here is using some of the wrist and elbow and hand motions and implanting them into the biceps and the triceps. This surgery has also been successful for people who have amputations through the shoulder. So as much of the remaining nerve structure that they can preserve, they've actually taken and implanted into the pectoralis, the chest muscle, and the back muscles. So it's kind of using that information, and then you would have electrodes that come over your chest and over your back, so that the same nervous pathway that you used previously for opening and closing your hand or flexing and extending your elbow, same nerve pathway is still there. It's just talking to a different muscle, but we can use the electrodes to pick up those signals the same way you would have used them previously. Another thing that's kind of in the study, still in the scientific study phase, but hopefully soon we'll start seeing, is implanted electrodes. So it's a way to get directly into the muscle that controls a certain motion. So you can see this electrode here up on the top photo on A is about the length, maybe a little bit longer than a pencil eraser, and definitely much smaller in diameter. And so for this particular individual, they didn't put him out. They did not anesthetize him for the procedure. He was wide awake. And they used some local anesthetic, cut some places in his muscle, implanted these electrodes, and stitched him up. And so now he has these electrodes inside of his muscle. And then when he puts his arm inside of the prosthetic socket, there's a coil here that picks up the signals from the muscle and sends them to create motion in the prosthetic limb. And so the idea with that is that the muscles that previously controlled a certain motion still control that motion, but we're picking it up directly at the site of the muscle. And so that eliminates some of the issues that we have with trying to pick up information from the skin. As you can imagine, it can get a little sweaty sometimes inside of a prosthetic limb like that. It's like kind of wearing a piece of plastic around your arm all the time, no matter the weather. And so something like implanted electrodes would eliminate some of the problems that we see with sweat or movement of the prosthesis. If those electrodes move off the spot that we've trained to be the spot to pick up motion, you can end up having a lot of issues creating that motion and using the prosthesis, which can be very frustrating for people who use a prosthetic device. And the big, great future of prosthetics is that someday, hopefully, anyone who requires an upper limb or possibly lower limb prosthesis too, is that we'll have these bidirectional prostheses where the motor nerves from your brain will be sending this information to control the prosthesis, and the prosthesis will have sensors in the hand and the wrist that can give you feedback through your sensory nerves about what you might be touching. So there could be sensors that sense hot and cold, or the feeling of something soft versus something hard, and that eventually over time will be very much not quite replacing the function of the human body. Obviously that's very complex, but that will start to be able to utilize some of these things like motor nerves and sensory nerves to directly control the prosthesis and get feedback from the prosthesis and really integrate this external device into the human body. So that's the big, great future. And there have been some studies that have already allowed people to have this feedback from the prosthesis, and hopefully someday anyone who uses a prosthesis will have that ability. So just some other innovations in orthotics and prosthetics. We talked a lot about upper limb prosthetics just because that's what our guy Mike Smith is experiencing right now, but there's tons of innovation happening all over the field of prosthetics and orthotics. Down here in the bottom left, this is a company called Unique. They custom 3D print covers for prosthetic limbs. And so we use a lot of 3D printing in our field. There's a lot of prototyping that's occurring with 3D printing. We're working on understanding if we can build sockets using 3D printing and build feet using 3D printing. But this company in particular has succeeded in creating these covers for prosthetic limbs. And while that seems limbs, maybe it could just be for the look of it and to make something pretty. They found actually that having a cover on a prosthesis has a lot to do with one's body image and one's perception of their own health and their ability to socialize and feel comfortable in their social life. So a lot of health benefits coming from 3D printing in our field. Up here on the top left is something called a C brace, and it uses a very similar technology to the prosthetic knee over here on the top right, which is called a C leg. They're both developed by the same company, and they use accelerometers, motion sensors to either, in the case of the C leg, it functions as the prosthetic knee, and in the case of the C brace, for somebody who has their limbs, they don't have an amputation, but they might have had a stroke or they might have had a spinal cord injury that has reduced the function of their lower limbs. And so these braces here that somebody can use can really help to restore a lot of the function after injury. And then down here on the bottom right, maybe you've seen this TED Talk before by a guy named Hugh Herr. He is a professor and engineer at MIT. He is a bilateral amputee himself, bilateral being both sides, left and right. And so he developed this foot. Originally, it was called the Biome foot. Since then, it's gone by a couple different names. But these are motorized microprocessor prosthetic feet that can get a sense of how fast somebody is walking, that can get a sense of what type of terrain they're walking on, and actively adjust as somebody is walking to accommodate somebody who's lost their limb. Okay, that was a lot of information. I hope that that kind of helps with your scenario that you're working with Mike Smith, gives you some ideas about, how we in the field would think about the future of prosthetic care for somebody when they have an amputation surgery, when they've come to us after having an amputation surgery due to cancer or due to any other reason. And so this is the thought train that I took when I read the scenario, and hopefully it's meaningful to you as you're working on your project and thinking about the field in general. It's the future of, it's kind of cheesy, the future of prosthetics and orthotics is here, but it is very, very exciting, and there's lots of work to do. If you have any further questions that I haven't been able to address today, please let your teacher know, let Ms. Pelletier know. She'll definitely communicate those to me. I'm hoping I'll be able to be on face-to-face when you see this recording, but if not, please let her know and I will be happy to answer any questions. That's all I've got.
I always love talking to you, Nicole. I always love hearing all of the amazing things and the awesome work. It's always so interesting to me, and I know my students will be very interested as well. I do have a quick question for you, though.
Yes.
Because I have so many students that they know they want to be in the healthcare field in general, but they're not exactly sure what part of the healthcare field. So what got you interested in this field to begin with, to actually go down the prosthetics and orthotics route then?
Yeah, definitely. I knew the exact same thing. So, when I was in high school, I knew I wanted to work with people. I knew I wanted to work with the human body. It's just so phenomenally amazing. And so I knew that's kind of where I wanted to be, but I didn't know exactly where. And I had been looking at physical therapy for a long time, and my mom is a physical therapist, and so she kind of had given me some information about that, and I was kind of on the fence about it. I wasn't certain, and she asked me, "Have you ever heard of prosthetics and orthotics?" And I said, "Nope. Tell me everything there is to know." And so she really got me introduced to the field of prosthetics and orthotics. And at the same time, I was seeing some videos on YouTube, and we were talking about it in my own biology class in high school. I saw somebody using an exoskeleton. She'd had an injury during skiing 20 years before, and she was walking for the first time on her own 2 feet using an exoskeleton. And I'm kind of a mushy person, and so that kind of, that hit me a little bit. And at the same time, we were watching a video about somebody who'd had an upper limb amputation in my biology class in high school. And so it's the things started kind of falling together. I personally love the field of prosthetics and orthotics because I get to deliver a device, something that I can hold and something that I can feel and something that my patient can feel. I get to hand that over to somebody, and it instantly makes a difference in their function. You can have somebody who hasn't walked in a year after their amputation. You put this device on and they're up and going for the first time in a year. And that is a very, very rewarding process. It doesn't happen like that every time. I don't mean to romanticize it, but it's very rewarding when you have those days where the whole family comes along for the appointment and you get somebody up and walking for the first time in a year. And the fact that I like working with my hands. I like working with tools, prosthetics and orthotics. Every day I call it big kid Legos. It's figuring out parts and pieces that go together well to create the best function for your patient. And that's very exciting to me. That was what was exciting to me as opposed to some other healthcare fields. Personally, no diss on other healthcare fields, but personally, I liked the idea of being able to deliver something that makes an immediate difference. And it's a process. It's still definitely a process, but the having a device in my hand and giving it over to somebody whose function is instantly improved was very attractive for me. And so that's kind of why I took the route that I did. And the prerequisites for orthotics and prosthetics are very similar to the same prerequisites that you'd have for physical therapy or occupational therapy or nursing. Lots of anatomy, physiology, a little bit of physics, a little bit of chemistry, a lot of things like that. But we're kind of this unique little puzzle piece in this whole rehab kind of environment. And we work very closely with other healthcare providers as well.
And this is why I love talking to you, because you're so passionate and it's so exciting to listen to you talk about it. So thank you on behalf of my students. Thank you so much for explaining all of this to us and sharing
Absolutely.
everything with us. So
I hope I can be there in person to answer questions, but if not, please relay anything to me and I would be more than happy to answer anything.
thank you so much.
Mhm.